If you were in a position where you had a terminally ill disease, would you choose to end your life? Recent news contemplating Brittany Maynard, a terminally ill patient with brain cancer, is in the news because she decides to end her life using physician-assisted suicide. Physician-assisted suicide allows patients to pass away when they want to. It allows them to be with their family and friends, and it also allows them to escape the pain. Giving every ill person this is not what I'm advocating. Every disease is different and should be treated different. Physician-assisted suicide should be legal in the U.S. If you had the chance to decide when something happens, wouldn't you? According to Brittany Maynard in Opinion 2.1, she has a peace of mind because she can decide when she wants to die. She wants to die a couple days after her husband's birthday so she can enjoy it with her husband, but she does not want to die before her 30th birthday because she cannot enjoy it. To die with dignity is something she always wanted. She doesn't want to be completely different around her family and friends in her last few days. It is comforting to know that she will be herself when she dies from physician-assisted suicide. According to Dying with Dignity, who is advocating physician-assisted suicide, on October 13th, Melissa Barber wrote that Brittany Maynard had an incurable aggressive brain cancer, and she had 2 unsuccessful surgeries, and the only way to treat it was full brain radiation. Full brain radiation, however, could destroy her quality of life, her motor skills, and she could lose herself in the process. My first main point demonstrates how physician-assisted suicide allows patients to pick the day and control the disease finally. Not only does it allow them to pick the date that they can die, it also allows them to be with their family and friends when the time happens. The article, Euthanization and Assisted Suicide, a Physician and Ethicist Perspective, wrote that it is comforting to be with your family while you're in a hard time. Whether you lose a sporting event or you do a bad test grade, it is always comforting to be around the people that love you the most. It is the same when you are dying from a terminally ill disease. Being with your family and friends is a comforting act that while you are dying that you know you're with people that care about you. A publicist of the Daily Journal for over 20 years wrote that it is the ease of mind of being with your family. It is also the ease of mind of being in a comforting place that you know about. Being in a comfortable environment means being at home or a place that you're most used to. A comfortable environment would not be at a hospital room that you spend most of your days during your disease. Many patients spend a lot of days in the hospital doing lab work or just having hospital stays that they do not want to have their final days in there. My second point explains that friends and family is a huge part of suffering from a terminally ill disease. As well as my second main point, the biggest advantage of physician-assisted suicide is to end the pain. In the Journal of Neurology, physicians wrote that terminally ill patients are always in pain. Whether it is mild to severe pain, it varies intensely. Patients say that they are in so much pain that they wish to die. It is inhumane to tell the patients that they are not in enough pain that they can't end their life. Terence Petty wrote that Maynard ended her life on November 3rd, 2 days after she said she was going to. She had frequent and long seizures throughout her disease. She also had severe head and neck pain and stroke-like symptoms. She had her worst seizure a couple days before she died. She lost complete communication and motor skills for several hours after she had her seizure. To review, that physician-assisted suicide allows them to escape the pain and be in peace finally. Physician-assisted suicide is a big controversy in the latest news. Ultimately, the decision should be made by the patient, the provider, and the loved ones. I have known people in my life who had terminally ill diseases. It is hard for their family and friends to watch them suffer and slowly fade away. Telling a patient if they can or can't kill themselves because they are in a lot of pain is inhumane. Only the patients know how much pain they are actually having. Every disease is different and should be treated different. I want you to think about what you would do if you had family or friends that had terminally ill disease. Does it seem right to tell them that they have to suffer for the rest of their life? The decision is ultimately the patient's and the provider. Physician-assisted suicide should be legal because of my 3 main points. They can decide when they want to die, they can be with their loved ones when the time happens, and they can finally escape the pain and suffering.